It is now my pleasure to introduce today's first presenter, AHA moderator Kayla Hayward. Ma'am, you may begin.
Thank you. Welcome everyone to today's webinar. This is Kayla Hayward with the American Hospital Association, and I'm pleased to be moderating today's webinar, Medical Imaging, Tomorrow is Almost Here. Today's event is sponsored by United Imaging. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We would like this session to be interactive, so we are looking forward to hearing your questions. If at any time you are having trouble with audio, please try refreshing your browser. You may also submit any technical questions into the Q&A box. At this time, I'd like to thank today's webinar sponsor, United Imaging. In today's webinar, we'll explore trends coming in several medical imaging modalities, especially those coming within approximately 5 years. These trends will impact hospitals and other healthcare organizations operationally, clinically, and financially. While 5 years sounds far away, is it really? We'll discuss how to know when to start planning for these trends and what signs to look for that will indicate the predicted trend is on its way to becoming reality. At this time, I am pleased to turn the presentation over to today's facilitator, Luann Culbreth, Senior Director of Corporate Advocacy and Outreach with United Imaging Healthcare. Welcome, Luann.
Thank you, Kayla. We're excited to be here and to do this webinar with the American Hospital Association. It's an honor to work with you all. And so we've got some things we want to talk about. We've been getting a lot of questions over the last year, especially now that things are coming into whatever the next normal might be. And this team, I've got some friends with me, as you can say, Troy, Guillaume, and Sherry, that you're going to hear from today. We've been spending a lot of time this year really focusing on listening at trade conferences, large organizations, various venues where really we've been listening to customers, we've been listening to folks in all aspects of healthcare, of them trying to figure out, well, how do I prepare? What's coming? What's going to be here tomorrow, and how do we prepare for that? So we thought we would spend this time talking about the trends in medical imaging, as you indicated. And certainly United Imaging is honored and pleased to be able to sponsor this and work in collaboration with the American Hospital Association. United Imaging is definitely a young company. We came into the world 12 years ago, and even into Houston, where we established some research and development center there. And now today we have our factory and our showroom in Houston, Texas. We encourage you to come visit us at any time. My contact information will be at the end of this webinar, and again, you'll also get this as well. Our website, you can contact us through our website if you will. But United Imaging, we're definitely built for the modern world, really focusing a fresh, bold, modern approach, very vertically integrated, where we're controlling our own supply chain, but even beyond that, all-in strategy, and we can't wait to teach you about that. So we really hope that you'll spend time getting to know us and getting to see what's involved in coming in the future. So as I mentioned, we kind of been spending some time listening to people trying to figure out what's next. And so when we look at the word trend, and we discussed, well, what's the definition of a trend? Because it can mean a lot of different things. So we went, of course, to the source and said, well, now we've got to deal with, are we going to talk about it as a noun or a verb? And you can see a lot of the definitions here really kind of look the same. And so we're going to kind of focus on what do we see trending operationally and what do we see trending in several modalities that my friends are going to share with you. Because you see there in these definitions, it's a general movement. It's a general direction. So whether you think of it as a noun or a verb, we're going to continue to focus in that way. So if we're going to think about what's in the future, we kind of have to look back as to what's been going on for the last 5 years. So I want you to think for a second, what were you doing in 2018 as it relates to medical imaging? I remember, attending conferences as usual, going to RSNA like probably many of you. And so really, that was pre-pandemic. We were in our routine. We were seeing things. But also, we were starting to see this pop up in front of us everywhere, no matter what conference we went to, no matter who we talked to. it was all about this new term of artificial intelligence, what we now call AI. And so that perplexed a lot of us, trying to figure out, well, is that going to help me operationally in my department? Is it going to be something on the equipment? Is it going to be something that helps the radiologist? What does this mean, artificial intelligence? And at the same time, we saw 3D printing. We saw things at various conferences that were being 3D printed. And of course, now we're living with them. We see them all the time. And so it was new to try to figure out, wow, they're even taking our images that we've acquired and putting them in these printers and coming up with models. Where will that go? What will happen with that? And then we also learned the term, the cloud. Where is the cloud and who owns the cloud? And more importantly, who owns my stuff? You know, whether it's my information, my images, my pictures. And so 5 years ago, we started hearing this term that, notice it wasn't about technology. It was more about information and IT. And again, where is this going to take us? So let's go to 2019. So we heard that in 2018. So in 2019, we were excited and expected to see more. And so, yeah, then we started seeing AI integration. It was actually starting to be utilized in various applications. More and more innovative technologies were looking at artificial intelligence. And of course, it's still growing today. We also heard the phrase machine learning. Well, what does that mean for us, machine learning? Does that mean our scanners are going to automatically scan? Of course, we see a lot about robotics doing all sorts of things. And certainly web-based applications in all aspects, whether it has to do with scanning, whether it has to do with physics, patient care. Again, new terminology for us in 2018, 2019 that we were really looking forward to seeing. Where is this AI going? Where is it going to take us? Well, now we have to go to 2020. And you all know where you were in 2020. You know what you were doing. You know what you were focused on. You also know what you weren't doing. You know how our entire lives, everything about it, personally, professionally, emotionally, mentally, were disrupted because of the pandemic. And literally 3 years ago, COVID-19 became the third leading cause of death in the United States. A trend we had not seen before, a trend that had not happened before, and certainly one we had to learn new, how to navigate and still keep our healthcare systems viable, how to keep our doors open, how to care for patients safely, how to keep our healthcare workers protected from this new pandemic. And so anything we had heard before completely changed. So then we transitioned into 2021 trying to figure out, are we going to get over this? Are we going to get past this? And what will now change for us in 2021? So what were you thinking about then? That was just 2 years ago in 2021. We got very familiar with terminologies related to telemedicine, telehealth. Perhaps we'd already been familiar with teleradiology, certainly, but then also virtual visits. We started seeing in 2020 and then more in 2021 that people were meeting with their healthcare provider virtually, just like we're doing now. We tend to master the meeting of virtually. But then in addition to that, we also were majorly impacted with supply chain disruptions in all aspects, again, in our life, not just in healthcare, but personally as well. So what about last year, 2022? It's hard to really kind of pick on a trend here, but obviously last year in 2022, we really started hearing that phrase, the new normal, focusing on workflow, workforce, because our workforce was exhausted in every way. They were worn out. They were sick. And they just weren't sure they could do this anymore. And so again, looking at those last 5 years, it's been very difficult to try to figure out what is the trend and where are we going to go. So now let's look at this year. Now it's the next normal is the phrase we're hearing. It's not the new normal. That was last year. This year it's the next normal, where unfortunately our health systems are struggling to keep their doors open. It's not that they're low margins, it's no margins. It's not that we don't have a lot of staff, it's that we don't have any staff. And it's not that we have to limit our hours, we can't provide that service line. And so clearly this has been top of mind for leaders very, very much so this year. The journal that just popped up in front of you now is the journal called Healthcare Executives. It's the journal from the American College of Healthcare Executives. And you see here that in the headline, health system CEOs are preparing for the long haul when it comes to addressing workforce challenges. And notice how imaging is underlined. We've heard about all the different service lines throughout this pandemic, but look, in this year, 2023, imaging is underlined as also an area of great concern for our leaders, for our CEOs. Here's an example of an article from that same journal talking about how really clinical staff is changing. And who are the clinical staff? What you were doing today may not be what you're doing tomorrow, so that we can help provide best service for our communities and keep our doors open. We're also seeing in that same journal that they're not so focused on recruiting, getting people in. They're very focused on taking care of ourselves, taking care of our own, rebranding who we are to give patients comfort and staff comfort to stay with us through this next normal as we move forward in this time. So what is next? Certainly through this time, we also got very, very adept at digital platforms. Obviously, we're on a digital platform now, but we ordered our food, we ordered our groceries, we order things all the time digitally. We'll get a ride to the airport through an app. We'll talk to our healthcare provider through an app. We'll connect with people through an app. And so digital platforms have really made it very convenient for all of us to have a better customer experience. They're easy to use, they're pretty streamlined. I don't have a lot of friction in using them, if you will. As long as my phone has battery power, I'm good to go with that. And so as we, as consumers of everything, have gotten used to these digital platforms, we also want that in our healthcare as well. So Mark Dixon, who was one of the key presenters earlier this year at the IDN Summit, really talked about the drivers of strategy in getting healthcare to move more to that consumer-based digital platform, because patients, we as patients, are having that experience with those digital platforms, and we like the rideshare app that we use. We like the airline app that we use. We like the grocery store app that we use. And so we also want to like the app for our healthcare provider as well. And so you're seeing that healthcare systems are very focused on that brand love, that brand stickiness, if you will. They're making very obvious investments into that. We're even seeing that the payers are driving people to more outpatient freestanding ambulatory surgery centers. So really there's a significant growth in virtual healthcare. And people are price shopping through that way. Just like we can price shop through our apps for our other everyday commodities, people are price shopping for healthcare as well. So there's a lot of strategies that are going on outside the healthcare market that are definitely coming over into healthcare to really focus on healthcare being part of that easy digital platform. We've also seen new competition, whether it be in primary care, retail clinic, home care, specialty care. You see a lot of those names mentioned that are familiar to you on the screen. And we, for a while, tried to figure out, well, really, how is that going to impact my operations? Where are my patients going to go? But you know what? They've got a new competition today, too. Because, again, it's virtual primary care. It's virtual urgent care. And perhaps some of you have even taken advantage of that. It's virtual disease management and being able to talk to a specialist virtually. So these are the things that are definitely on the mind of our leaders, our operators, and our C-suite, our chief financial officer of our health system, no matter what kind of health system that is, an IDN, an academic, an imaging center chain, no matter what that is. And so Mark shared with us earlier this year sort of the top 10 areas of concern from the C-suite, if you will, through the first half of this year. Definitely you see there the workforce resilience, financial recovery. We're definitely still in clear and present danger, as you said. We're seeing other programs such as diversity, equity, inclusion grow. Consumerism, again, definitely how we consume things outside of healthcare, that transitioning to our healthcare as well. Physician strategies, what hospitals are doing with physicians to keep their stickiness as well. Population health, the ambulatory strategy. Again, COVID showed we could do a lot of things outside the hospital wall. Disruptors, competitors, machine learning, bots, chat GPT, all of that is things that we're very focused on from an administrative perspective in order to sustain our health system and continue to grow to provide the best patient care. So those are some of the things that have been on the mind of the C-suite that we've been talking about, we've been focusing on, that we wanted to share with you. It's hard to really see where that trend is going to continue to go because, again, these are just from this year. These are things that are top of mind. So as you as leaders in healthcare systems, no matter what that role is, whether you are the C-suite person, whether you are the technologist, the director, the manager, you've got a key part in this. You have a critical role in this as we all continue to work together to see our trend continue to move in a direction that is sustainable for our health systems. So with that, now I'm going to transition over to the modality team. I'm going to start bringing in my friends who are experts in various modalities. And you're seeing that I'm going to ask them to really kind of focus on, in these various modalities, what are key trends that are predicted that are 5 years away? What are they? Why is it important? What should we know about them? What does that mean clinically? What does that mean operationally? What does it mean financially? And when do I need to start preparing for that? So I'm going to bring in 3 of my good buddies who are superstars in their area. And first I want to introduce you to Troy Luann. Troy is a MRI technologist at heart, has worked in the MRI industry for a long time with key OEMs, and now leads a very significant service line in MRI. And so he's going to share a few minutes with you about trends that he sees in MRI. So Troy, thank you for joining me today. I look forward to your presentation and the conversations afterwards.
Thank you, Luann, and welcome to everybody on the line. To old friends and new friends, I look forward to meeting you again. As Luann had said in the excellent introduction, a little bit about United Imaging, more about what's going on currently as trends in the C-suite. As mentioned, my name is Troy Luann, VP of MR in the United States for United Imaging. I'm going to walk you through just a couple slides and introduce you to what's going on currently in the market and what you can expect is going to go on over the next few years. Now, prior, what I want to give is just a couple of disclaimers. This isn't going to go tremendously deep. So if you're not an individual who is not so familiar about MRI, we're not going to talk physics today. We're going to talk overall umbrella trends. Next thing we're going to do is talk about some things that I saw at what we call the International Society for Magnetic Resonance and Medicine in Toronto of this year. This is where the new trends occur, all vendors present, and so I think you're going to find it very interesting as we go through the next few slides. So as mentioned, key trends and predictions. What's important for me, first of all, is to introduce you about what's going on in the current market. You may or may not have what's in front of you as far as certain coils, certain scanners, certain capabilities, and that's okay. But what's important is that you know currently what your competition is using, what your colleagues are using, and what vendors can actually offer you, United Imaging included. So first of all, the patient experience is tremendously important. As Luann was talking about things changing from a social perspective, coming out of COVID, there's multiple generations now that have phones. People can go to your facility and walk out and rate you right away. And this is internationally about 4-star experience, 3-star experience. And that's very important for healthcare networks to understand that the patient experience that you provide is extremely important, no matter where you go around the world. Years ago, people would say, oh, you know, MRIs are noisy, they're uncomfortable. That's not the case anymore. There are new capabilities that can make it completely quiet, very, very comfortable, and expand that patient experience. So first and foremost, on the left-hand side under patient experience, you're seeing a patient lying on their back with their shoulder up in the air about to go into an MRI system. That is called an ABER view. Pronounced differently depending where you are, but that is a very, a shoulder over the top of the head, which can be very painful. So we are now in a reality where the coils actually form to the patient. They're light, they're comfortable, they're non-threatening. So it's summertime, right? Down here in Houston, we're just finishing. If somebody falls down and they break their elbow, they're not going to extend it before they come to the MRI suite. So this coil can very easily wrap right around them, and your technologist can get the examination completed. So it's those areas of difficult positioning where these coils really benefit you and your technologist and your department. Quiet and fast scanning. As mentioned before, we can now have completely silent examinations across all sequences where people who have had traumatic brain injury, geriatrics or a little bit more nervous, or pediatrics, very important from that perspective. And then bore sizes, wider and wider and wider. Around the world, 60, 70, 75 now with United Imaging at a 3 Tesla level allows people to fit very comfortably inside of a bore. So patient experience is extremely important. Artificial intelligence. I actually really enjoyed seeing the comments of some people asking about artificial intelligence. It shouldn't be perceived as a threat. It should be perceived as something that can help your department be more efficient, and your radiologist more effective, and your technologist more consistent. So I'm talking about operational efficiency for you and your department. So exams with artificial intelligence and deep learning have become extremely fast and with very high image quality. That's important to understand. The sacrifices of something called case space, of changing and skipping lines and not getting information, has tremendously changed over the last few years. So if you're not doing throughput in 5 to 10 minutes, of course, radiologists work with you and your department to determine the speed, but you can do scans in minutes instead of seconds. And specifically those series in examinations being under 10 minutes or just over are very commonplace in musculoskeletal imaging and neuroimaging, a little bit longer maybe on the abdomen and prostate side. Imaging artifacts have been eliminated, and that is by these types of algorithms. Very important to understand. So those pesky little artifacts that used to be very commonplace in small structures of the meniscus in the knee, or the brain, or the cartilage in the shoulder have been eliminated by these types of artificial intelligence sequences and support. So there's been a real good benefit, not only operational efficiency, but elimination of artifacts. And then again, motion reduction. You go into an MRI scanner, people want to not spend a tremendous amount of time in there, whether the schedule is late or whatever it might be, or they're just intimidated by it. So there's been some real benefits, is my point to you. And then the other one is automation, and I think of consistency. And this is artificial intelligence driven, but also automation where somebody can lay down in a scanner and their respiratory gating and monitoring is automatically completed. This is industry leading from a United perspective. We use something called a millimeter wave radar that has been in the industry for agricultural surveys, weaponry, autonomous vehicles. So this allows you to not have to worry about setting up your patient. Your patient is automatically set up. Self-planning examinations for very common exams, abdomen, shoulders, spine. So when your technologist shortage impacts you, these can be something that drives consistency into your department. So there's been a lot of real good benefits that are out there right now that you need to explore if you don't have these right now. And the return on investment is a matter of months, right, not years. And then lastly, before I move to our final slide, remote system monitoring. We can now predict if and when a part may be starting to fail. We can log into systems and do automatic downloads of software. So those types of things are current opportunities for you, and they are in the market. And then moving to the next slide here, again, I mentioned to you here in the next few minutes, we're going to talk about what I saw as the future. Now, it is very hard to predict what's going to happen in 5 years, right? It's very hard to predict what's going to happen in 3 to 5 years, especially with things moving very fast. But taking the information on the previous page about what's currently out there and now building upon it, here's what we're starting to see up at the International Society for Magnetic Resonance in Medicine. Now, other metabolites, right? You're going to hear from my colleagues here in CT and PET-CT and MI shortly. Now, they're doing some excellent things beyond hydrogen imaging, and MRI is trying to do those same types of things. So right now we're looking at hydrogen, but we want to start to look at things that are metabolism. Maybe we're going to look at diabetes, and you're hearing a lot about Alzheimer's, and combinations of PET-MR scanners that are out there right now. We want to do functional exploration and start to really understand therapeutics and their targets on disease. We want to see when your cartilage is going to break down. Instead of, 10 years before it breaks down, instead of saying, hey, by the way, your cartilage is broken down. We want to understand lung capacity and lung disease before your lifestyle changes. So this is predictive, this is very informative, and this will allow people to live a longer and healthier life. And I would say there are challenges with it. The particular signals in MRI decays very quickly, so we might have to use things like hyperpolarizers, certain injectables and therapeutics to see it. But the point is, this is very interesting for a lot of people, and they've been working very hard at it. The other one is field strengths. For a while, it was only 1.5 T MRI. Maybe it was 1.0 T. Maybe there were certain magnets that were, I would say, superconducting magnets. But the industry has really kind of spread out from 1.5 and 3 T to lower field and to higher field. Now, higher field, a lot of times, research is associated with it. There are some challenges at lower fields too, right, with certain saturations of what we call FATSAT and others. The point is the trends continue, the exploration is very exciting, and a lot of the focus right now is on how quickly you can do things and what you can see in the brain and how we can map the brain for, again, Alzheimer's, traumatic brain injury, oncology, surgical intervention. So it's very exciting. But those artifacts can actually increase as the field strength goes up. So it's not without its challenges. But I'll tell you here on the last part before I turn it back over to Luann, from the MR side, we're working very hard to bring AI and automation to your facility to make you more efficient, more predictable, and with the best IQ in the industry. And so that's very important. We're also working very hard to give you those quantifiable results that let your radiologists read faster and understand the impact to the patient. That's important. And then again, it's more patient-centric. And I want to end with that because the fact of the matter is, even though we're chasing CT and we're trying to go as fast as CT, we want to produce the best image quality for you and allow you to differentiate yourself in the market. But it also needs to be patient-centric. They need to have a great experience. They need to tell their friends and family of what a great MRI exam they had and how fast and comfortable it was. And so as they return for maybe an unfortunate disease or their grandmother, their grandfather, their children come and see you, it's been a good experience for them. So I look forward to your questions at the end. And again, I want to thank you very much for your time today and your attention and taking an opportunity out of your busy day to see us. So Luann, I'm going to turn it back to you for the next part of the program. Thanks, everyone.
Thank you, Troy. That was excellent. And of course, and a lot of people that know me know that MRI is my passion, so it's exciting to see that for sure. More to come. Well, my next friend I want to bring up for you is Guillaume. Guillaume is, again, another individual who's been working in the industry for a number of years for OEMs. And he also is a medical physicist by background. So we kind of had to tell him he can't teach physics during this webinar. We really wanted him to focus on the trends of CT. But I'm super excited that Guillaume is able to join us today. So Guillaume, I'll turn it over to you to talk about the trends in CT.
Thank you so much, Luann. I will do my best to not talk electrons and physics and little details. Well, welcome everyone. Thank you for listening to us this afternoon. I am going to talk about a couple of trends, a little bit like Troy, coming back a couple of years to explain where things are going. And I will focus on two main areas, I should say, technology, operations, and also new opportunities that are offered by some interesting hybrid experiences that the industry is looking into. So I'll start with this interesting question. Is the slice war over? First of all, the slice war was entirely started by the industry. I think it was not a super good idea to start with, but if you look historically, I would say 4 or 5 years ago, the 16-slice CT market kind of started dying off, and at least in North America, all those scanners were replaced by 64-slice scanners. And now we see currently the same trend going from 64 to something else, to 128, 160, which becomes the new norm. The real question here is not the number of slices, is the clinical capabilities of the system. And I think that we have reached a level where we can answer the vast majority of the clinical questions that CT can answer without having to go any further in those detector development, at least in terms of coverage. And actually, we've reached a point where the return on investment, so to speak, is not there anymore. It's coming too, or not cost effective anymore, to continue to add more hardware to answer questions. So as an industry, we clearly need to start using our brains a little more, I should say, and more creative thinking. And the trend is actually stopping here on the hardware side and clearly evolving towards using this hardware in a more clever way. So as Luann said in introduction and Troy highlighted also, software, automation, and more specifically AI entered the scene, or our scene, and our departments and our scanners. And for now, I have to say most of it has been focused on CT being closer to a commodity modality, if you want to say it this way. We've been focusing on making things faster and removing user variability, so which are very honorable goals. That's what we've been doing overall over the last couple of years, and we continue to do. We are at a point today where you can literally, tell the patient, hop on the table, and we have all sort of elaborate 3D real-time cameras that will essentially recognize the exact position of the patient, whether they are, prone, supine on the side, feet first, head first, and we'll set up the acquisition parameters accordingly. It's actually even better than this. If the patient starts wiggling and moving on the table, the technology can follow and adapt in real time. So we can do pretty elaborate things, but all of them have been focused on creating the images faster and better in a more reliable way. So, which is all good. Now, where I see things going very clearly, two directions. The automation and the intelligence is going to start spilling out of the box, spilling beyond the scanner themselves. So just to go back on this camera and visual recognition technology, we are not very far from having tools that would actually identify the patient as they or he or she walks into the room and recognize the patient, automatically pull their prescriptions from the pack there is or wherever things are, and pull up the protocols automatically. So the only missing step is really put the patient on the table, and the rest the scanner is already handling on their own. I also see AI changing what I call human-machine interface. The way technologists interact with a CT scanner today is a little bit like, it's technical. You need to set up KV, MA, table speed, pitch factor, those kind of things which are all necessary, but not necessarily the most interesting. However, we are at a point where we could pull out from the prescription, automatically set up customized, personalized acquisition parameters just based on the prescription. So have a clinically based way to drive the acquisition instead of a technical or technically way based to drive the acquisition. And this to me makes more sense from a provider standpoint, and the technology is almost here to be able to do things like this. So switching gears a little bit, and I took one of the statements that Luann had in one of her slides. What's the next normal? Well, no margin, no staff, no service. Pretty much as usual, you are being asked to do more with less, which is all good. How can we as an industry help here? And there is a trend that started maybe a few years ago, involving remote interactions in general. So it started all from the service side, where manufacturers started putting sensors in the scanners and would remotely through VPN connection get health reports from the machines. And the goal was, well, we could see a trend, like maybe a tube was about to fail, so we proactively come and replace the tube. Right? That's all good, and it's useful, and it's kind of mostly the norm today, and this slowly changed, especially around COVID time, but also before, in not only monitoring devices and health performance of the machine, but helping people run the machine. You have maybe an examination that you don't do that often, and you don't exactly remember how to do it. You call the vendor is going to remotely log into your system, take control, show you, and guide you through the acquisition itself. So for sure with COVID, sorry, I don't say that right, there was a clear need that we needed to do more remotely, and remote scanning started popping up all over the place. So of course there are, especially with an X-ray producing scanner like a CT, there are some regulations that we need to navigate around, but this is something that is becoming a reality in all modalities as a matter of fact, and is an answer, potential answer to staff shortage or highly qualified staff shortage, where you can have one subject matter expert driving multiple scanners at the same time, assuming based on the local legislation that there's a one body on site. So those trends are definitely not going to stop, and I think will become the norm in the next few years. Now, just to finish, I want to open up this and go, I mean, CT, I'm showing PET images, but there's a good reason, because in a PET CT, there is CT, and until maybe 3-4 years ago, really the CT technology used in PET CT was mostly used for attenuation correction, so which is something you need to reconstruct the PET image. Well, the industry has started changing that, and United Imaging for sure was on the lead front here. By instead of putting just a CT in a PET CT, we started putting true diagnostic CTs in our PET CTs. And that kind of makes this hybrid technology, now you get the best of both worlds. So you can use the PET CT as a diagnostic CT, even if you, without acquiring PET. Of course, from a business standpoint, this can make a lot of sense, because you don't have to buy a second piece of equipment, you don't have to have a second service contract, you don't need a second room. If your PET CT was kind of underutilized, you maximize the utilization of your equipment, so on and so forth. There are other trends, so this started a few years ago, but there are other trends in the same spirit, and a lot of them have to do with therapeutic fields. So there are already multiple offerings for, multi-modality interventional suites, including CT and MR, all packed together. But I think even more impressive and probably bolder combinations can be found in fields like radiation oncology. I mean, I don't know how many of you are familiar with that field, but we start seeing things like this. LINAC, which is the machine used to treat cancer using radiation, combined, integrated fully with CT. And why? Well, just because all radiation oncology departments have been using, or at least in North America for 20 years, a CT scanner to define a 3D model of the patient and customize the treatment plan. And then you put the patient on the treatment machine and you use very poor 2D or like 3D images, that's kind of poor man CT, to try to make sure your patient is in the right position. Well, why would you use the real thing? And here you go, it's coming there. And actually, when I say it offers new opportunities, it's because now not only you would be able to acquire an image every day, compare that with the pen and make sure the patient is positioned the right way. But if there are any major anatomical changes or any major changes, you can actually redo your plan right there on the spot. And that's what I mean by new opportunities. So things to watch for sure. Luann, back to you.
Thank you, Guillaume. I learned a lot during that. I really did. So I appreciate your perspective. And I think I also learned that the next time I go for my CT, it's going to know me when I walk in the door. And it's just going to say, Luann, lay on the table, put your arms above your head, Luann, and we're going to scan you now, Luann. That's going to be fascinating because that's also how the apps on my phone work. So thank you, Guillaume, for that. Now it's my pleasure to also introduce another good buddy of mine, Sherry Gottke. Sherry, again, has been in the industry for a long time. She has the heart of the technologist, if you will. So she's going to talk a bit about DR, and then she's going to go into molecular imaging. So Sherry, thank you for being with us today.
Thanks, Luann, and I thank all of the attendees that have been on the phone call. I hope you're finding it informative. I have the pleasure of talking about the two oldest modalities, and quite frankly, the ones that are not going to go away. X-ray is still a main entry point for imaging, and certainly through COVID, long-haul COVID, all of the things that we're seeing as anomalies of this specific disease has really caused X-ray to make a boom. AI is going to be important, and we all hear about AI, but this is about the technologist. This is about improving workflow, improving interpretation. AI seamless to the user, but focused on productivity. How can we get the patient as they deliver to the imaging center or the waiting room? How do we get them into the room? How do we get their images done quickly, automated for the technologist for ease of use, but reproducibility? And how do we get that final report out? We want it to be predictive automation for the technologist. Again, they're the ones that have really been hammered through the last couple of years with all the chest X-rays, but we want to make the automation purposeful to what their job is and what they need to do. We need systems to handle larger patients effectively. 700-pound tables. You'll see in a lot of things that United Imaging does, 700 is the new standard. And not because we want to make sure that we provide the best care, but we want to provide this for you to bring new referrals and new patients into your departments, into your imaging centers, and always focused on the lowest dose and optimal image quality every time. We know that digital radiography is predicted to grow from 10 to 15 billion in 2025, and those are just industry-leading specifications. So how do we automate it for the technologist? How do we make it reproducible? How do we make this modality easier to use and more fun to use to provide the ultimate patient experience? Because as Troy said, they're walking to the parking lot and they're giving us a score in X-ray. And this is a modality that, you know, I've been an X-ray tech for a long time. It's not going away. But how do we make it more useful? We make it more reproducible. We make it more automated, and we make it a quick turn for information from the waiting room to the clinicians. Molecular imaging. I had the advantage of being at the Society of Nuclear Medicine in June. That's our RSNA. We know that in the next 5 years, we are going to continue to see diversification of PET-CT procedures. We're going to shift from guided therapy for oncology and neurology, and we're going to go into cardiac PET. Why? Because the information is more predictive of disease, and quite frankly, it only takes 30 minutes. So opposed to 1 to 2 days in maybe a nuclear medicine or SPECT world. We see increased sensitivity and specificity in detecting cardiac disease. So if we're not doing cardiac PET today, 5 years ago, it was maybe 5% of what we did, and now it's approaching 15% of what we're doing in PET. The other buzzword is theranostics, which we're taking radiopharmaceuticals for both diagnostic and turning them into treatment. This has just been an explosive technique. So you're going to see as I go through this presentation what's been FDA cleared, what we're doing for diagnosis, and what we're doing for treatment. The best way to prepare for that is to go into the digital world with PET-CT, because no matter where the theranostics is going and radio tracers are going, you can treat all energies of radiopharmacy and see them in PET. So detecting new pathologies, sending in the tracer, then back into the patient to deliver a targeted therapy. Much like Guillaume said, do the CT, do the treatment plan, do it live. Some estimates are that theranostics could soon develop into a $30 billion area. And I think that that is treatment for you, the providers of the treatment, and cost effectiveness for the patients. So this isn't about me, and this isn't about United Imaging. This is the busiest slide on the planet. But what you're seeing is prostate cancer. This week, an article was published that if we did a PET prostate exam on any male over 65, it isn't watching PSMA, what is the blood level, what are we doing, here's a biopsy. We know there is or isn't cancer, and now there are effective techniques that say eliminate the biopsy and take it to treatment earlier. And I think that for any of us who have dealt with prostate cancer in our family or our friends, this is a long cycle for men in this area. And quite frankly, it's very, very nerve-wracking for the patient to think, do I have cancer or not? What's my next blood work going to be? So we're going to use molecular imaging more effectively to treat that. One thing that I'm passionate about is breast cancer. So a certain fraction of women in this country and around the world get breast cancer. We're seeing that for metastatic workups, you can find out, is the breast lesion there, and are there already metastasized? How do we get into more effective treatments for these women and men with breast cancer to take the mortality rate and take it down? The last thing that was published in July was an FDA announcement for the treatment of Alzheimer's disease. As we get older, as our parents get older, as our friends get older, we're looking to link diagnostic treatment to slow things down and slow the progression. So getting an early nuclear medicine scan, PET-CT scan is allowing us to really move into a new era to make the quality of life improved. And all of these things are done by all the radiopharm companies and for Lilly and other people doing treatment. So ology is important. Neurology, urology, and cardiology are the things that we really want to go. So if we look at a couple of industry leaders for providing health care, they're looking at scan volumes increasing in PET. And my prediction is they're not using any of these ologies, that this is where the market is predicted to grow from 10 and 15% to maybe 30%. RadNet, their PET-CT volume in Q1 was up 20.9%. So more patients as we get older are getting into the system. So effective look at disease, do we have it? Digital PET allows us to do that very, very quickly and with lower doses to the patient. And then how do we treat these patients? So as the treatments for theranostics come in, how do we have a more targeted look at your treatment and quite frankly be able to see in months versus years what's going on with the treatment? Increased number of patients, we need trained technologists. We at United believe in our user interface to be very, very deliberately done. AI is used in a lot of algorithms and reconstructions to really automate things, but really help the technologist and the radiologist dial in on the disease and do it with data sets that are quite frankly matching the scanners that you're doing. We know that treatments can provide you additional revenue streams. So faster patient exams, lower overall dose, getting the treatments that people need. So Luann, I'm going to hand it back to you.
Thank you, Sherry. Boy, a lot of things going on in the molecular imaging world, and just that whole term of theranostics that we started hearing a few years ago has now really come to life. So that's exciting. It gives hope for our future and a lot of things for our health systems to really think about. So now in the last couple of minutes, I would like to ask each of you, hopefully Troy can join us as well, in terms of preparation, because obviously our audience has been listening to you all and thinking about things, and experiences that they're having and where do they go from now. And so really it's about preparation at this point and what do they need to start thinking about in terms of developing next steps to be prepared, and can those preparation steps actually help them, sort of apply broadly in other areas of healthcare as well. So I'm going to go in the order that you guys presented. If you'll take maybe a minute each. Troy, we'll start with you in terms of your thoughts around preparation.
Sure, no problem. I think it's an excellent question to address. And if we think back to the presentation about currently what's going on in the market and about the future, the things you need to do is, number one, understand what your vendor offers, right? If you're in a position where you have kind of a dedicated agreement with one vendor, you need to look outside of that vendor and understand what the capabilities are, because you're not always getting the best pricing that you think you might be getting. You're not always getting the best, and again, this is just broad. I'm not saying anything specific to any vendor, but you want to understand what's in the market. You want to understand what you might not have been shown, right? And again, these are expensive assets in MR, so they last for a long period of time. But technology does change. Return on investment is very fast. So I would say, if you think back to the presentation that we had in MR, and what I told you, do you have some of that current technology? That's important to understand. Are you best serving your patient, right? So think about what was discussed, and not so much about where the trends are, just understand if you're current right now and where we might be going. But again, bring your vendor in, understand their capability, and also look at other vendors like United and others that have entered the market that are younger and are offering things a little bit different. So just become informed is really my point that I would reply to that first question. So.
Thank you, Troy. Guillaume, what about your perspective?
So when it comes to CT, I think the industry has been talking about standardization for a while, but it was talk. But the technology now, and beyond the technology, what you need to look at are business models that are offered in addition to technology to support this standardization. I think we're here now. And so I would say it is a very good time to start looking at, especially if you have a fleet of devices or several facilities, to start looking at truly implementing standardization, because now it is possible. Looking at how service lines are being managed in different facilities and making it really something that is completely homogeneous. At least at United, we have developed tools and business models to make it a reality. So I think it's a good time to look into this.
Okay, thank you, Guillaume. Sherry, your perspective on preparation.
I think automation for some of the basics exams. I think that automation in radiology, I certainly remember x-rays where we used calipers to measure the patient. We went to the technique chart, we dialed it in. I mean, it took a long time to do things. And now with the new automation that says, I can click on the history, click on the protocol, touch a button, and the machine is getting into place so I can have time with the patient to make it a better experience. And then all of those things allow us to get better x-rays and better images for our radiologists to read. In PET, I'm going to tell you digital PET. Digital PET, because this field continues to move. I've spent the last 15 years of my career watching and always talking about another tracer, but you saw my slide earlier. I have never seen the explosion of treatments coming. And partnering with the ologies is not something that nuclear medicine has done or PET-CT has done. It's focus on finding cancer and then move the patient along. Now with theranostics, being able to dial in a treatment that's specific, deliver it and look at it, and provide a better and a quicker path for a patient that's experiencing any of these diseases, Alzheimer's, prostate cancer, just general metastasis for women. Dialing into the treatment and having the right tool, digital PET will allow us to focus quickly in the market of molecular imaging. Digital is better in all aspects of that.
Thank you, Sherry. Certainly, all types of cancers impact all of us, so this is certainly an area in theranostics that everybody's going to be watching as we move forward to the future of healthcare. So just a reminder to the audience, I know we've just got a few minutes left, but please submit your questions. We are going to take those questions here in just a minute. but we'd like to kind of step through our key takeaways that we want to make sure that we focused on today. And first, really, I'll start is regarding consumerism in healthcare. We're pretty much there. If we're not fully there, we're almost there. So again, that stickiness, that ease, frictionless, how easy can I get access to care, and how quickly can I get treated for that care, we're there. And so as we continue to look at operationally, how are we going to keep our healthcare systems viable, we need to be able to respond to that consumerism and respond to the trends in the market so that we can continue to provide health care for all. Next, we had Troy talking up, and he was talking about artificial intelligence. And so really kind of what he wants you to know, the impact has been positive, and certainly it is here to stay. And that's not just with Troy with MR. You heard it in Guillaume. You heard it with Sherry as well. So it's not going anywhere. It wasn't just a pop-up fad, if you will. We're going to continue to learn more and more and more about artificial intelligence as we go through, even again, the next 5 years. Guillaume talked a bit about hardware, how really, that slide 4 may or may not be over, but maybe it's not about the hardware, and that hybrid systems with CT are definitely bringing in a new perspective for us to look at from the technology side. Sherry talked about DR, the automation, and of course, AI there, really driving the productivity, making those technologists an easier work environment, a faster work environment for the patients, and then obviously with PET, finding that disease early and being able to treat it effectively. So those are some of the key takeaways we wanted to share with you all. We've got a couple of questions that are coming into the chat, one of which, Guillaume, comes to you because it's talking about CT dose. Really, where do you see radiation dose going at this point in time with CT? Because it's been top of mind for a long time, and so it's the perfect physical question for you.
So it's interesting, like about 10 years ago, everybody was like FAHRA, and we had a point where CTs are now acquired with the amount of dose or 2 equivalent to chest X-ray. So I think, as I said, like the hardware has been pushed so far that we can still probably go a little further with new technologies, but we're reaching kind of a limit here. So once you're at the level of the X-ray, you're not going to do much better than this. Little margin for improvement, but not much.
Thank you, Guillaume. There's also a question in the chat about artificial intelligence, and obviously we've all talked about it in some way, but this has to do with an anomaly that shows up, because obviously AI is trained on predictive things that it's seen before, but this is about, obviously we're scanning patients and we see new anomalies pop up for them from time to time. And so, Troy, I'll go to you. Your thoughts around when a new anomaly shows up, how is AI going to be able to respond to that when the training has really kind of been based on a predictive model?
Well, I think, sometimes anomalies in MRI are not necessarily anomalies. They can be artifacts. They can be protocol-driven. They can be inconsistency from a technologist. And I don't, that's not a finger-pointing exercise at all, but those who have adopted artificial intelligence and deep learning have done a comparison first, right, to get themselves comfortable, right? Run your particular protocol with and without it. Do a comparison. Have your radiologist who is involved educate themselves on this, right? And I think that's where the most successful integrations have occurred. There's a number of things that can occur across modalities. So that's how I would answer it. Just that get familiar with it, understand it. And there's also peer-reviewed literature out there to develop confidence on these particular sequences as well. But my colleague Guillaume is very, very, I would say, very well versed in this field, and I'm going to turn it over to him to expand on that very important question.
Yeah, I'll add one thing. Reconstruction is not going to be a problem because AI for reconstruction is not expecting anything specific. AI in reconstruction is used to denoise, remove the noise from the imaging, improve the contrast. It's not expecting any specific structure. So I don't think there will be any issue there. There might be when we go to post-processing, which is a completely different issue. And there, yes, if the anomaly is really completely different from what the AI algorithm has been used to be trained, it may miss it, it may not understand it, But vendors usually highlight that and say, there is something here, I don't know what that is. And if this is something that happens more and more often, we collect the data and integrate that in our training models, and then we keep on progressing this way.
Thank you, Kim. So to our audience, thank you for joining us today. We are at time, and we want to respect your time, but it's been our pleasure to spend a little bit of your day with you. We appreciate you listening. We will continue to get questions. We will work with the American Hospital Association to follow up with those. At this point in time, again, it's our honor to be with you. United Imaging is thrilled to be able to partner with American Hospital Association, not just sponsor this webinar, but provide this webinar. So really, we look forward to you getting to know us more. And with that, Kayla, I'll turn it back to you.
Thanks, Luann. And that does conclude the time we have today for questions. Any questions that were unable to be answered in our allotted time will be shared with the speakers for follow-up offline. I want to thank our panelists for their time and excellent presentation, and thank you to our sponsor, United Imaging. To learn more about the content presented today, please check out the resources section on your webinar console and complete the post-webinar survey. In the next few days, all attendees will receive an email that will include a link to the archived webinar session. Thank you again for joining us today, and have a wonderful afternoon. Thank you.
Thank you, ladies and gentlemen. This concludes today's teleconference. You may now disconnect.